It remains the #1 sexually transmitted infection in Canada, which in some instances can lead to the development of certain cancers. About 75% of sexually active people will get at least one HPV infection in their lifetime, and traditionally the only method to detect an infection is through a Pap test. Today is HPV Awareness Day, and the province is rolling out a new form of testing that is more accurate and sensitive. So for more on this, we're joined this morning by Dr. Christine Palmay. Dr. Palmay, good to have you here this morning to talk about this. I mean, this impacts so many people across the province, and this new test. Can you talk about the significance of this test?
So most significantly is actually HPV Awareness Day, so this is really timely. So up until recently, for the past 50 years, we've been doing a Pap test, which is essentially a scraping of a female cervix, and those cells get analyzed by a pathologist to deem whether they're normal or abnormal. And based on that, that would ensue a chain reaction of treatments if needed. We're now looking upwards and realizing, as you mentioned, that because HPV is the cause of many cancers, including cervical cancer, we're actually now testing for HPV instead, so one step behind, which means we are catching more cases ahead of time that could potentially lead to cancer if left untreated. And we're not over-treating changes that don't necessarily need to be treated. From a patient perspective, the procedure is the same. It's an exam, it's a pelvic exam, but the interval of screening will change. So if a woman has a negative HPV test, no HPV, we can be reassured that she'll be fine for the next 5 years, and her next test for HPV will be in 5 years instead of 3, which is the current guidelines.
Does that change, though, if you have more than one sexual partner over those 5-year period?
No, absolutely not. The test is so sensitive as well. We can actually look at other patients with other risk factors, and perhaps the interval will change according to whether you have other comorbidities, etc., your past history. But really, we've extended the time interval, which means less pelvic exams for patients. And the really exciting thing from my perspective is the next iteration of this, hopefully by the end of the year, will be self-sampling. So patients can order from public health, kits to do at home, return to public health. And, so important with a lack of access to primary care, people who, have had histories where they can't go through pelvic exams for whatever reason. And then, of course, if you think even one step further back, we are still advocating for vaccination. That won't change the screening interval, but you want to super protect yourself and get the screening done at the appropriate interval, and also make sure your vaccine status is up to date.
Is this something that needs to be equally important or thought of or considered for both men and women, doctor? Yeah,
excellent question. So cervical cancer obviously pertains to females. HPV itself is linked to many types of cancers, not only cervical, oropharyngeal, anal, and unfortunately, Nick, we do not have screening measures for our male patients. So the reality is the best way for our male patients to protect themselves is by getting vaccinated. And in Ontario, we vaccinate boys and girls in grade 7. It varies according to where you are in Canada.
The thing about vaccines, though, we had Dr. Bogosh on, we're talking about the measles outbreak right now in southwestern Ontario, sort of post-COVID or even during COVID, there was a movement away from vaccinations in certain cases here. That must be quite troubling to you as a doctor, seeing people less into getting vaccinated.
Well, for a couple of reasons, too. Right now with everything that's happening in the United States as well, in terms of changes to medical guidelines, et cetera. Absolutely, and the reality is, I was trained in the era of vaccination, so I would struggle to identify a measles, even a chickenpox case if it came into my clinic, because I haven't seen it, which is the glory of medicine, but also quite tragic. We're going to have some sick patients that come through.
Now that's not good news, doctor. In terms of prevention, abstinence are sort of just one sort of way to do that, but that's not necessarily in the cards for a lot of people clearly here. What are some of the other preventative methods, or is it really just vaccination?
Yeah, you can talk about abstinence, which is obviously not convenient. We never want to smoke, obviously. Condoms are not fully protective against HPV, and it actually isn't even just sexual activity, it's intimate sex. So really, don't smoke. But the reality is most Canadians are sexually active. That's the reality. So make sure you're doing your screening for cervical cancer, and then think about vaccination, which is the best form of primary prevention.
Absolutely. Okay, Dr. Palmay, appreciate the time as always. Thank you so much for being here this morning. Good to see you again.